Hi, everyone. We'll just give everybody a minute to make sure that everybody is in that's trying to get in. I see a couple people coming in. We'll just give it about a minute. Okay. I think we'll get started. So I'm going to do a little double duty tonight. I'm going to be the moderator and the presenter. My name's Kristen Druger, and I'm the principal and the principal of Health Insurance Personalized, co-owner and partner with Golden Financial Group. We want to thank everybody for joining us today, and I'm going to go to our next slide. We have an upcoming webinar every third Wednesday of each month. 6:30 p.m. via Zoom, like we're doing now, and we're going to be speaking a little bit, October 19th, needing help when it comes to financial and legal strategies. We have a great seminar on November 16th, holding a productive family meeting, and December 14th, what to do with mom's pet right around the holidays. So those are some of the upcoming meetings that we're going to have. First, I'd like to say that we are Senior Services Network of Southeastern Pennsylvania. We are a professional organization that provides free resources to seniors in that Southeastern Pennsylvania area. As you can see, we have a website and we also have a Facebook page where you can go online and look at all of the professionals, get their contact information, and also look at upcoming webinars and things like that. So we can see a little bit here about how you can connect with us. And we always like to put on here how to report elder abuse, neglect, anything like that through the Area Agency on Aging. And this is the 800 number that goes with that. So I'm going to stop sharing right now and get our presentation. So just bear with me one moment as I get the other presentation up and running. We want to make sure that we have that. Okay. All right, everyone. All right. I'm just trying to make sure that I share the right slide with everyone. And we'll get going. All right, so here I am. This is Kristen Druger, and our presentation tonight is the ABCs and Ds of Medicare. As I mentioned, I'm with Health Insurance Personalized. We're located in the Doylestown area. I'll give you a little bit about myself. I'm a partner with Health Insurance Personalized, and I'm also the owner and principal of Golden Financial Group. We're independent insurance agencies located in the Doylestown area. I have over 25 years experience in the licensed health, life, long-term care, travel insurance industry, serving the Southeastern PA and surrounding areas. My team and I believe in a needs-based approach, and we meet with each of our clients individually and find out what their goals are, what they're looking to accomplish, and try to mitigate any risk that we can moving forward. So I'm going to get started, and we're going to go into a little bit of an overview of Medicare. And what are we going to do? Get an idea of what Medicare is. I'm also going to talk about the different options for Medicare. And as we know, or a lot of you may not know, every year there's also an annual open enrollment for the Medicare season. And it's October 15th to December 7th. And those are some opportunities for people to make changes on certain parts of their Medicare option. And that's what we're going to talk about a little bit. What should you do during this time of Medicare open enrollment? So what is Medicare? It's a federal insurance program, and it covers most, it's a complete coverage, and it covers most of seniors. But there are some exceptions to people ages 65 and older. There's also people that have certain disabilities and anybody who has ESRD, which is end stage renal disease. So those people immediately are eligible for Medicare. What are the coverage options for Medicare? We're going to go over what each of these means because sometimes it can be an alphabet soup of Medicare. So we have Part A, Part B, Part C, Part D, and then something called Medicare supplements or Medigap plans. And I know that these, like I said, can be an alphabet soup. There's everything from parts to plans, and they all have letters of the alphabet to identify them. So it can be a little tricky sometimes to understand exactly what is what in this Medicare space. So original Medicare. So original Medicare is Part A and Part B. Part A is for your hospital. Part B is for your labs, your other doctor's visits, outpatient things. And this is what your Medicare card will look like. I always tell people, look at your red, white, and blue card. And if you'll notice where it says hospital Part A, and it has a date, and then there's medical Part B and a date. They can be the same right when you turn 65 or after you are with an employer with health coverage, or they can be two different dates, or they can both be an age beyond age 65. So we're going to go into a little bit of a conversation about that. And what is a special enrollment period? Why would you need additional insurance instead of original Medicare? So we'll continue with that. So what is original Medicare? I touched on it a little bit, but Part A is hospital insurance. It's things like inpatient hospital, nursing homes, hospice, home health care. You have out-of-pocket deductibles. I've updated the information for 2023. So Part A deductible, if you go in the hospital, we're looking at $1,584 of amount that you would need to pay. And then there's Part B. So that's medical coverage, everything that is not hospital related. So you're looking at doctor services, any home health care, any sort of preventative services, medical equipment that you may need. Those have premiums, deductibles, co-insurance, co-pays, and Part B of original Medicare covers 80% of those costs. And there's no gap on that. I mean, no cap on that. So 80% of the costs, and then you're responsible for the other 20%. So that's why in the mid-90s, they came up with a Medigap plan, because that had changed, that government program had changed. And now they are offering through private companies something that would help or supplement what you get with Medicare Parts A and Part B. So Part C, it's an alternative to original Medicare. It's a Medicare Advantage plans. You're going to hear all of this come the October timeframe all the way through to December. We even hear these commercials on TV through JJ Walker, or you might have Joe Namath talking about something. It's referring to this Medicare Advantage plan. One thing that we really need to be aware of when you're looking at Medicare Advantage plans is that there are variable costs that are predetermined by each insurance carrier. There is a government cap, and this is new for 2023. This is increased, and these are the new numbers. It's $8,550. So what does that mean? That means that if you have any sort of service that is not covered through a Medicare Advantage plan, your out-of-pocket costs could max at $8,550. That's an important area, because we're going to see the difference between a Medicare Advantage plan and a supplement and what that would be. Also with the Medicare Advantage plan, sometimes it covers Part D. Part D is D, think of D as D for drugs. The D plan covers your drug benefits, and that has a whole different tiering system on what you pay and what you don't pay based on your level and where you're at with your insurance throughout the year. Okay, so Part D, we just talked a little bit about that. That's the prescription drug plans. Some of the Part C Medicare Advantage plans have a prescription option in there, some do not. You need to be very careful of that. We want to look at that. But if you have a Medicare supplement, then you would have a standalone Part D or prescription drug plan, prescription drug coverage. They have a monthly premium, they have deductibles and various copays based on the type of plan that you have. And that's what you can look at and figure out what is the best option given your particular combination of drugs that you take, your prescription plans. So Part D coverage, it's a little bit different than what we're used to in the non-Medicare space. There are initial deductibles. These are the different tiers that you go through, or different, like a roadmap of where you would go between an initial deductible, an initial coverage limit, the coverage gap or the donut hole, and the catastrophic coverage. So what I'd like to do is just explain each of these a little bit because it can be new to a lot of people entering into Medicare. Most plans have an initial deductible. And again, because these are government plans, this is a government issued amount. So initial deductibles for certain plans across all of the Part D plans, unless it's a plan that has waived the deductible and has increased a premium, is going to be $505. Some drugs are in the deductible, some aren't. That varies by a particular plan, and each plan is different. And then you go to the initial coverage phase. That's where you pay a percentage. There's a co-insurance involved. And once the out-of-pocket co-pays and the amount that the carrier or the plan pays on your behalf reaches that $4,660, then you move into what is called the coverage gap or the donut hole. Think of a donut, you're getting most of the good stuff there, but you don't get anything in the middle of the donut. It's the donut hole. And that's 25% of the cost of the generics and the brand name drugs, from the $4,600 mark up to the $7,400 mark. That is the donut hole. Most people on Medicare reach that towards the fourth quarter. It's not always the case, but the fourth quarter is when you will be, most people get into the coverage gap, and then they would be spending more on their medications at that point. And then if you're so lucky, and that I say that facetiously, to have so many drugs that you go beyond $7,400 of payment out of that, then you go to the catastrophic phase. And in the catastrophic phase, that is the lowest amount that you would pay. And that's the 5% insurance. And it shows you there the amount for the generics and for the brand name and all other drugs. That has increased. And these are all 2023 rates. So these are different phases and things that you should just be aware of. Every year you'll get a printout from your carrier and it'll tell you where you're at within each phase. So we're going to speak a little bit about Medigap and Medicare supplement plans. So remember, we talked about original Medicare, Part A, Part B. In Part B, there's that 80% that is covered. We're looking for, these are plans that cover the additional 20%. So if Medicare pays for something, the Medigap, the Medicare supplement will pay for the additional 20%. That includes things like co-insurance, co-pays, deductibles. And then that's why people look into a Medigap plan. It's really important to enroll in these plans at the appropriate times, because during those times you have guaranteed issue. And that means no underwriting, no issues at all. You will be accepted into that plan if the plan is offered. They will have to accept everybody on a guaranteed issue basis. So when you're enrolling, here are things to think about for Medicare, regardless of whether you choose a Part C Medicare Advantage plan or whether you choose a Medigap plan with a prescription Part D. You want to factor in, what are your possible healthcare needs? Do you have any chronic conditions? Are you relatively healthy and you take no prescriptions? Those are things you want to think about. Something that has really come up in recent years, because everybody is working longer, is it's called the COBRA trap, so to speak. So you do not want to go on COBRA after you leave a company and not sign up for Medicare if you're eligible. That is very important because they do not, the government, when you're signing up for Part B, does not consider COBRA to be a credible coverage option in lieu of Medicare. Small group, large group health insurance plans, most of the time are considered credible coverage, but COBRA is not something that is considered credible coverage. And please remember not to postpone enrolling in Part D. Part D, remember, is the drug plan, even if you take no medications. It's very important to be in a credible coverage, Medicare approved plan. And there are some very inexpensive plans out there, but sign up right away when you're eligible. You do not want to sign up later because if there's a late enrollment penalty, it carries with you for a lifetime. So those are things to really remember as you go through enrolling and consider as we go through enrolling. Okay, so the initial enrollment period, when can I sign up for Medicare? You can sign up for Medicare right when you turn 65, and you have 3 months after the time that you turn, in the month that you turn 65. So if somebody's turning 65 in September, they have their month of September, October, November, December. They need to have enrolled in Medicare. Now, Medicare Part B has a premium. I get this question a lot about, well, what if I don't take Social Security? How do I pay for Medicare? Because Medicare premium, Part B premium right now for 2022 is $170. It will, if you take Social Security, it will come out of your Social Security benefit. If you do not, you will get billed, and they'll bill you for your Part B premium at that point. But you can get Medicare at 65 without taking Social Security, because as many of us know, the full retirement age for Social Security is not necessarily at age 65. It could be longer, but you will have that ability to get Medicare and health insurance at age 65. That's your initial enrollment period. The reason that's important, remember, is because it's a guaranteed issue period, no underwriting. And if a carrier offers a Medigap plan or a Medicare Advantage plan, they have to take you at your initial enrollment period. Okay, how do we enroll? This is a very big question that I get a lot. We enroll, there's a couple of ways. You can enroll online for Parts A and Part B, and you go to ssa.gov to enroll. You can also enroll over the phone and call Social Security. You call Social Security to enroll in Medicare, or you can go in person at your local Social Security office. And those are, they're still taking appointments at Social Security. So you would go online or you would call and you would make an appointment at the local Social Security office. Now remember, Part C, Medicare Advantage, and Part D, prescription drug plan. You really need to take the time, find and compare the plans, see what kind of plan works for you. And you can fill that either online or a paper application. And something in here is use an insurance broker. The reason I say that is not just work with me, but work with an insurance, a Medicare insurance person, because it's no charge to you as the consumer. And we get paid as a commission based the same amount, regardless of a carrier that you're working with or any particular plan that you're trying to work with a client on. It's a free, you pay no money as the individual consumer, but this is something like I work with Medicare every day, all day, different insurance plans. These are things that I know the ins and outs of. And it can be a daunting task for a consumer or somebody new to Medicare, making sure that you make the right elections at that time. Okay, we did talk a little bit about late enrollment penalties. So for Part A, there's no penalty unless for some reason you have not paid anything into Social Security. And you'll automatically be enrolled in Part A at age 65. You don't need to do anything. All the insurance carriers, even if you're continuing to work, know that you have Part A. Whether it's your primary insurance or it's a secondary, depends on the size of your group benefit. Part B, you will be assessed a penalty if you don't elect Part B during your initial enrollment period, or like I said, a special enrollment period. A special enrollment period, the most common one is that somebody continues to work beyond age 65. Their employer offers credible coverage, and they've had continuous coverage since age 65. Once they leave that company or retire or go part-time and they're no longer offered benefits, that's the special election period. And you have 63 days from that time of that event to enroll in a Part B without any penalty. Some people just didn't realize that. So there is a general enrollment period for Part B. You can enroll in Part B every year from the 1st of January to the end of March, but your effective date for the Part B won't be until July 1st of that year. Again, the Part D, I think we talked enough about why you would want to enroll in a Part D right away when you're eligible. It's the same type of thing as the Part B, either the initial enrollment period or a special election period. If for some reason you did not elect in Part D, as in dog, you want to go during the open annual enrollment period, the AEP, and sign up for some Part D plan. That will stop the penalty because the penalty is cumulative. And again, it's a lifetime penalty. So if you know somebody that has not enrolled in Part D during the open enrollment period, they should really look at some options. Okay. And we did talk a lot about a special enrollment period. What is that? It allows the individual 63 days from moving from an employer-sponsored plan to enroll in a Medicare plan. And you want to get with somebody, or if you feel comfortable enough doing it on your own prior to your retirement, to make sure you have everything in place for that retirement date, and you won't have to rely on COBRA for any health insurance. Again, that COBRA trap that we have that we don't want people to get into when they're Medicare eligible. So annual enrollment period. I think I mentioned the date a couple times. The things that you can do during the annual enrollment period from October 15th through December 7th every year is look at a different Medicare Advantage plan. If you're in a current Medicare Advantage plan and you want to look at other options or see if you're in the best plan for your particular health care needs, that is the time to do it. And then the Part D. Most people have Part D also have a Medicare supplement. I tell people once you're in the supplement, most of the time you're going to be happy. You just pay the premium and you keep paying the premium. You want to review that Part D every several years. At least every 2 to 3 years. Every year is possible, but if not, every 2 to 3. Again, a qualified insurance broker can certainly help you out with looking around and making sure that you're in the best Part D plan or the lowest out-of-pocket cost plan for your needs. Again, during the annual enrollment period, these are the things I ask my clients, and I say, just let's talk a little bit about that when we meet. Has your health changed? Are your healthcare needs changing? All of a sudden, maybe you were diagnosed with something that you didn't have last year. Let's just make sure we're in the right plan for that. Has your financial situation changed? Maybe before the supplement was fine, but something tragic may have happened and your financial situation has changed, and we need to look at a Medicare Advantage plan, maybe a $0 premium plan. Something else that comes up a lot. Have you moved? Will you be away from your main area for a significant amount of time? Is your insurance going to be able to cover you when you go somewhere? How about, are you traveling frequently? You're retired now. Is there something that we can look at as far as making sure you're covered if you travel internationally or across the United States? And again, the coverage needs. We want to make sure that your doctors are in network. Are all the prescriptions covered? Is there things that may not be in a supplement that I need, like a dental or a hearing plan? Or maybe you're in a Medicare Advantage plan and you want to look at additional benefits with another plan, like a dental or a hearing option. So those are things that you want to look at year to year during the annual enrollment period. And here's the big questions that I have been asked through the years. Why should I review my Medicare Advantage plan? I like it, everything's fine. Same with my Part D. Why would I even do that? Many people don't realize that the premiums and the services that the carriers offer can change. What they offered in one plan may not be offered next year, or maybe a copay has increased, or out-of-pocket expenses for a specialist have increased. We want to look at that and see. The other thing that is very important, as I mentioned earlier, are the prescription plans. Formularies with each carrier change every year. Drugs are added on, drugs are taken off. What was a tier 3 is now like tier 2. And you want to just do what I call a shop. You want to shop around and make sure you have the best plan or the lowest out-of-pocket cost plan for your particular situation. Maybe your medications have changed from what you originally had. You know, this year your doctor may have prescribed 2 or 3 additional medications. We want to look at that and see. And now they're coming out with some robust benefits for dental, vision, and hearing for seniors, people who are Medicare eligible, people on Medicare. And that is new to the industry in just the past couple of years. So what if I'm eligible and my spouse is not? What do we do with that? Well, we need to look at an individual medical plan for somebody that is not a Medicare recipient individual. They might be able to go on COBRA with the employer. So that could be an option for them until they're Medicare eligible. Again, speak with a health insurance professional to help go through those options. We are always happy to help our clients go through that, and it's a no cost obligation to just give somebody some sound advice on what we think might be the best option for them. Okay. So I have an opportunity to answer any questions that anybody has. I'd be more than happy to help in any way that I can. I know that we are taking questions in the chat. If anybody wants to put a question in the chat room, I'll wait a minute to see if there's anybody that might be interested in that. Or we could perhaps unmute. Let's see if anybody has a hand raised. Okay, somebody just said, here are new things about Medicare for the new law just passed. How will that impact Medicare? I'm not quite sure I understand the question. Here are new things, or are we hearing new things about Medicare from the new law just passed? I'm not exactly sure what law we're talking about. A couple law, oh, the insulin cost. Okay. So the insulin cost, those are, a lot of plans have recently, and negotiating for lower drug costs. Perfect. Okay. There are new laws that they are definitely an insulin program. A lot of the carriers have offered insulin co-pay programs that are no more than $35 a month. If you are, excuse me, if you are a Medicare Part D provider, and insulin is something that you provide, you have to provide that at no more than $35 per insulin refill. Now, there are some particular insulins that are covered and some that are not. If it's, and those we'd have to look at individually in each particular plan. So they are, and they are, again, can you put your question here? Okay. And negotiating for lower drug costs. Yes, Medicare is always lowering and negotiating for lower drug costs. They have people and lobbyists that work with people to even lower that gap that we were talking about earlier, the different tiers. There's talk about that, but nothing has been put into practice yet as far as lowering that coverage gap. So that is something to be seen as the years go on. Okay, so Dennis, if you could put your message question there in that area. Excuse me. There are so many different things coming out with the formulas, but really the best thing to do would be to get with somebody who is an insurance professional to go through each person's particular drugs and come up with the lowest out-of-pocket cost, because you'd be really surprised at just the combination of your drugs and which carriers have a better plan or not. And it's also something that I tell my clients, don't just look at the premium of the particular Part D plan. You also want to look at your total out-of-pocket spending for the year, because somebody might be on a $73 a month Part D plan, but yet they are only spending, I'll say, $300 for their drug costs for the year. And somebody could be on a premium for $7.20 and pay an astronomical amount in copays and co-insurance. So it really does matter with the combination of the drugs and making sure you're with the carrier that supports those drugs at that time. Now, another question I get asked about the prescription drug piece, a lot of times people will say to me, well, what if I get a new drug in the middle of the year? Can I switch plans? No, you actually cannot switch Part D plans in the middle of a year. You have to wait till this annual enrollment period, but it will be covered. In most cases, if Medicare covers it, your plan will cover it. They have to cover a certain amount of prescriptions in certain tiers and categories. It may not be the exact drug that your doctor prescribed. There might be a generic drug that'll be there, but you will be able to get a drug in that particular therapeutic category. I know I've done a lot of talking, so if there's anybody that would like to speak to me offline, or if they have questions, they can certainly email me. I'm going to go back to the original slide so that everybody has a chance to contact me if they need to. Oh, wait, I'm sorry for the fast moving slides. Okay. So this gives you my contact information if anybody needs to reach me. I'd be more than happy to answer any questions you have on anything that relates to Medicare or individual health insurance or small group health insurance, questions like that. I'd be more than happy. It's important to be educated and understand what your options are as you explore this new world of Medicare. So let me just make sure we go back to the option, talk about some of the other topics that we're going to be discussing in the next few months. Okay, so as we conclude, just another reminder, upcoming webinars are the third Wednesday of each month, 6:30 p.m. via Zoom. For October 19th, we're going to have some dynamic speakers talking about financial and legal strategies, managing transitions that will be coming up as we get older. November 16th, with the holidays coming, a lot of people are wondering, how do we have a family meeting? Let's talk about mom or dad that we need to move to the next level of care. How do we hold a productive family meeting? What does that look like? What are some of the ground rules and topics that we can cover? And then on December 14th, right before the holidays, maybe a family member is going into a nursing home or a skilled living, or can't take care of a family pet any longer. What could we do? We're going to have somebody from the SPCA. There's a lot of options out there for people. They get a lot of questions around the holidays. So we thought we'd bring that information to the group on December 14th. Again, this is the Senior Services Network of Southeastern Pennsylvania. There's some information on how to connect with the Area on Aging. We also like to deliver all the senior resources in one place. That's why this dynamic group of professionals has gotten together and tried to offer those resources to people in one space for everybody to be able to access. So I think that's it, unless I see any more questions. Oh, I see a chat. Oh, two people raised their hand but didn't put their questions into the chat. So I'll just leave a minute, see if there's anybody that might have another question, if they want to put it in the chat, because for some reason I'm not able to hear the question, but I could certainly read it if anybody wants to do that. Okay. And again, you can always call me if you have questions and we weren't able to get it in the chat. I'd be more than happy to answer any questions that anybody may have. So I hope it was informative, and I hope everybody got a chance to get some information that they didn't know prior to this. If you ever need any help, like I said, I'm here to help in any way that I can. And all of our members of our senior services network are always willing and able to help with any questions that seniors may run into. So without any further ado, I hope everyone has a great evening, and we'll see you next month. Thank you.